Good evening, everyone, and welcome to the webinar tonight. My name is Bianca, and I'm here with Dr.
Hey, Bianca.
Hello. And tonight we are going to be talking about all things full mouth dental implants and the New Teeth Now procedure. So we are so glad that you have joined us tonight, and we want to answer your questions. So in our chat box on YouTube, feel free to type any questions you have, and we'll get those answered for you tonight. But I'm going to start off with our exciting week last week.
We had a big week.
Yeah,
we have. So we actually had a patient come down from Mississippi that had this procedure done about a week and a half ago. And we actually have a video of her, and she's going to talk about her experience kind of from a patient standpoint of everything she went through, which is really cool for you guys to hear, because it's kind of like a no holds barred,
like actually how the experience goes from pre-op to surgery day till
pre-op to surgery to everything.
Yeah.
The good, the bad, the ugly, the very cool parts of the procedure. And she's going to be very, very happy when it's all said and done.
Definitely.
Yeah. So we'll go ahead and get started. Thank you guys for joining us. We're going to show a bunch of before and after pictures, talk about the entire procedure, and you'll get to hear from a couple of different patients, including patients and her experience. But we'll go ahead and get started.
I'm a little nervous, but I'm super excited to get this little journey started. Today I'm going in for pre-op. I'm going to get some pictures of my mouth, get a game plan for surgery on Thursday. Hello. Hi. It's everything I expected. I think it may be a little bit more than I expected. I've always been confident in my decision, but coming here and just meeting everybody, I'm, I guess, even more confident, more comfortable. A lot of information at once, but she explained it so well. I feel very comfortable about everything. So this is the first set I will get, and it's very nice. She didn't show me this set yet. I was like, yeah, I like that. But then she showed me this one, and I was like, oh my God. This is like the Cadillac of teeth. This is nice. And I don't know how to explain that unless you need teeth. Like, these are really nice. And these aren't even permanent. These are just temporary, so.
So we were able to see patients today for a consult. And she's kind of describing her history and kind of her journey with her teeth and having to have all the upper teeth and all the back lower teeth removed. She had an upper denture made, which she wears pretty routinely, a lower partial that she just can't stand and never wears. She's very fortunate. She's got enough bone to do the procedure and have the implants placed. She needs a little help in the back part of the upper jaw due to the location of her maxillary sinuses, and probably also a combination of having the teeth removed. The bones shrank up a little bit, sinuses have dropped, so she needs one zygomatic implant on each side in the back. I think, so she's a pretty straightforward case for kind of the surgeries that we typically do and the experience we have with the zygomatic implants. And there's not a lot of people that are actually routinely putting in the zygomatic implant like we are. And she's pretty straightforward.
Dr. K was very chill, very laid back. He made me very comfortable, almost like a friend. I feel more comfortable about surgery. I definitely am happy with the choice I made to come here. That was a lot better than traditional impressions. This was a lot more comfortable. I didn't have to gag or choke on any rubber substances. I think with each step I'm getting even more excited. I just picked out like the shade and the size, and it's starting to set. It's really starting to set, and I'm really excited.
I'm going to take all of this to your primary recovery area, and what you're going to do, you have a seat right here. That wasn't supposed to happen.
Long time coming.
Take very good care of you, okay? See you when your surgery's all finished.
Thank you.
You're welcome.
Okay, the day's here now, so we're all excited. So she's going to have both upper and lower done. We're actually going to do one zygomatic implant on each side to give her a lot of stability so she can get rid of her denture and have this full implant supported bridge in that can last her the rest of her life. I'd say somewhere around like 3 hours, 3 hours for the surgery. That includes removal of the teeth, cleaning everything, making sure there's zero infection in her mouth. We've got the temporary teeth ready to kind of use as a guide today, placing the implants and then scanning everything so the lab and Dr. Nafal and the restorative team can design those teeth that will go in at the end of the day. Yeah, so we're all finished. One zygoma on each side, 4 traditional implants in the front and the middle, 6 regular implants on the lower, all went in tight, spaced perfect. I mean, she should get a great result. She'll go shortly to the private recovery room, and we're just waiting on the lab to finish designing and making her teeth. Let me help you. Let me help you. Yeah, now bite. Not removable.
Thank you.
Yes.
You know, this was very, very recent. She has no idea yet the end result and how nice it's going to be because she's still going through the immediate
Recovery.
Yeah, so it's going to be fun watching her go through the process. And I'm sure if you guys want to follow her, we're going to have links or anything.
Yeah. If you go to our New Teeth Now, like Instagram or Facebook or TikTok, she's on there, and she's at Trailer Park Pretty. That's her Instagram and TikTok. So you can follow her journey, but we're doing a lot of reposting and things, so you can follow the journey and just kind of see how it goes, like day to day. Literally, she's posting all of the phases.
Yeah.
It's really cool.
Which is very cool because she'll kind of go through, and she already has, like some of her experience. And she was, I think one of the comments that she said was, it was different and maybe a little more than what she expected during the immediate recovery. So patients do get a little bit of swelling and bruising. And we talk to patients about that every day during the consults. And, you know, even though what we tell patients to expect, I think when it actually hits them, they may rip or not realize that I didn't know I was going to have that much swelling. And they don't. I've got pictures of her immediately after. She did actually really well. A lot of patients will have, you know, no swelling and bruising. Some patients will have a lot of bruising, and some patients have, you know, a little bit of swelling, a little bit of bruising. She had a little bit of both. But you can see here, this picture is taken kind of immediately after we put in her temporary zirconias, which on her, we were able to do, let's see, we did the procedure on a Thursday and we put these on Monday. So literally like 4 days after, this is her. And, you know, she'll great. She's doing really well. Little bit of swelling, a little bit of bruising, but her outcome looks really good at this point. So she's going to be, I think, very, very happy with her end result. And she's right now, she left to go back to Mississippi in temporary zirconias, which is just a very cool thing to do for patients. We'll jump right in. And this is her before and after. So she came in like a lot of our patients do, in different phases, different, just everybody has their own unique experience how they get to us. And she came in literally with a complete upper denture and a lower partial. So she had all her remaining teeth on the bottom, but she was missing all the back molars. She had a partial denture that she just would never wear. And then she had a complete upper denture. She was okay with this upper denture. It looked good in pictures, but it was one of those things that was very difficult to deal with, just like all of our other patients that are in dentures. And she had to use a lot of denture glue or the adhesive to help hold the denture in. And, for a young lady who has to deal with a complete denture that comes in and out, you're not supposed to sleep in these things. They're meant to wear during the day. It helps you look like you have teeth. You can eat with a denture, but it's something that you shouldn't have to deal with every day. So she took it out, put it on her nightstand at night, and she wanted something more predictable, more secure, something that she could treat like natural teeth. So we had been talking to her for a while about coming down to Lakeland and having this procedure done. We finally got her down here, and we were able to do this procedure where we put in 6 implants on the upper. She had enough bone that we could do 6 implants on the lower. She did need a little bit of help, which is one of her struggles. She didn't have a lot of bone in the back part of her upper jaw, so we were able to very predictably treat her with these zygomatic implants, and you can see those on the screen. They're kind of the longer implants. They anchor into the lower part of the cheekbones, and they're kind of a tool that we can use to provide patients like her with enough support to be able to hold this full denture without doing any elaborate bone grafting, putting her through a bone graft procedure, and waiting on that bone graft to heal. We can do this in one day with the zygomatic implants. And we're very excited to be able to do this with her, and we can't wait to follow. And we'll keep you guys updated on, her progress and her end result as she goes through the process. But we're very happy with her result at this point. So kind of moving a little bit past her, a little bit about me. So I'm originally from Kentucky. I did all of my school at the University of Kentucky and did my surgical residency at the University of Florida in Jacksonville. And one of the things that I'm very proud of and that you guys should be thinking about when you're choosing who's going to be doing this procedure on you, I am a board-certified oral and maxillofacial surgeon, and wherever you're having this procedure done, you want to make sure whoever's treating you is board-certified in their specialty. It's kind of the way that we hold each other accountable and make sure that we're all up to a certain standard of care. And it's not easy to become board-certified. So you've got to go through all the proper channels to all the testing and making sure that you're up to that standard of care. So we are located, our primary office is in Lakeland, Florida, and we also have a office in San Diego, California. So we're kind of on the East Coast and West Coast. We're very proud of this office in San Diego. There's a couple of really good oral surgeons there. So if you're closer to the California area, by all means, you can go there, but we would love to see you in Lakeland. Our surgeons, we have me, Dr. Richards, who is one of my partners. I've been with him since 2007. He's been doing implant surgery since 1980. I mean, you think about that. That's a long time and a lot of experience doing implants. And then in the San Diego area, we've got Dr. Shafi, Dr. Evans, and Dr. Z, and they are all very qualified, very experienced in doing this procedure. And so wherever you're located at, whichever location is closer, make sure you call this number and we can get you scheduled at one of these offices. So there's a lot of offices out there that are doing this type of procedure. If you're on social media, I'm sure if you're Googling or, with AI, definitely they'll start targeting you if you're Googling implants or bone loss or different type of arch procedures. And one of the things that differentiates us are these key differentiators. And you want to make sure whoever is treating you from the surgical standpoint, you want to make sure they are board certified oral surgeons. You want to make sure they're very proficient in zygomatic implants, and having the procedure done under general anesthesia that is a huge bonus. And as far as safety concerns, it's the safest way to have this procedure completed. We do that here in Lakeland. They do that in San Diego. And a lot of centers will talk about, anesthesia. And they'll say, oh, you're asleep for this procedure, but you're really not. When they're talking about being asleep, they're talking about IV sedation. And there's a big difference between IV sedation and general anesthesia. So here, with what we do, and especially with patients, when you saw her video, so when she had all of her upper teeth out and had her denture made, she was actually awake for the entire procedure, which for me, that's just something I'm really not a big believer in doing this to a patient awake. It's just not a fun thing for a patient to sit through. There's nicer, easier, safer ways to do this, and that's why we do the general anesthesia. So what we do here in Lakeland is we have a separate anesthesia team. So they put you to sleep, and you're totally asleep, just like you would be for any outpatient procedure. So there's a breathing tube that goes in, so your airway is protected. You've got the separate anesthesia team that's monitoring you from an anesthesia standpoint. And then me or Dr. Richards or any of the San Diego surgeons, they can focus purely on the surgical procedure. So we can make sure that we're doing everything that we can do possibly correct to get the implants in the best possible position. So you've got the best outcome from a stability standpoint to support that full bridge that goes in that we want you to have for a lifetime.
Right.
Patients always ask me like, well, how long do these implants last, or the bridge? Well, they're designed to last you forever. So as long as you need these teeth, these implants, if you take care of them, they're designed to be there for as long as you need them to be. So just a couple of things, and I'm going to go over that slide again later on in the PowerPoint. But those differentiators, they really are kind of setting the standard on when you're thinking about a procedure like this. You want to make sure a board-certified oral surgeon is the one placing the implants. They're very proficient and experienced in the zygomatic implants, and that it's done under general anesthesia. So it's the safest, easiest way for the patient to sit through this type of procedure.
Yeah, so if you're taking notes, those are questions you need to ask at any provider that you are researching.
Yeah, and we hear that. So when patients come in for a consult, they'll talk about, it's very, very common for a patient to come in and they're like, you're my third opinion. Or I've seen another clinic before coming here, and, we'll go through those differentiators, and it is very common for a patient to tell us, they didn't really talk about that. They talked about me going to sleep, but they didn't talk about the general anesthesia or the IV sedation. And they're like, I'm going to call that clinic and ask.
Right.
Or they'll just say, what, hey, they didn't really talk to me about that. I'm more comfortable here. I'm coming to Lakeland to have the new teeth nail procedure. So that's just very, you want to keep that in mind.
We did have a
questions on
question. Yeah, so we have a lot of people from Florida, which is really cool. Some people that are not in Florida. How would, how does it work for an out-of-state patient?
Yeah, that's a great question. Yeah. So definitely, I'll talk about that some, but go to our website, because we kind of talk about that, the process of treating an out-of-state.
Add that link.
Yeah, exactly. Kind of that experience, because we do have a lot of patients because of these key differentiators that come in from out of state, out of the country. And we've actually treated a patient from every state in the U.S.
Yes.
Not counting our out-of-country patients. So we've had a patient come from every state, and they come here because of that, because of the general anesthesia, the zygomatic implants. And that's usually one of the things that drives people here, because a lot of our patients will come in for a consult, or they'll call and just say, hey, I've seen some other oral surgeons, they're general dentists, or they're periodontists, and they told me that I really didn't have enough bone for implants. And then I see you for a consult, and after looking at you, doing a full mouth exam, getting a 3-dimensional CAT scan, and I'm looking at the patient like, you've got plenty of bone to do this. And I've been doing this since June of 2007 here in Lakeland, and I've yet to see a patient that I couldn't treat because they didn't have enough bone to do this. Really, the only patients that have ever had to turn away are just patients that medically could not go through the procedure, that their primary care or their cardiologist or any other medical specialist just told them, like, look, you can't go through this procedure under general anesthesia. That can make you, not a candidate. But that's super rare. I mean, it would be very uncommon for me to see a patient that we couldn't do this procedure on. This is a great question. So, like I said at the beginning of the presentation, if you guys have any questions, make sure you submit those, and we're going to try to answer as many as we can live on the air tonight. So the way we do this procedure is you do not have to do one implant per tooth. And actually doing this, there's a lot of advantages of doing this procedure. The way we do this with our new teeth now, so we do 6 implants for the upper jaw is pretty much the gold standard. 4 to 6 implants, the lower jaw is gold standard. And you can see from this picture the way they're placed. There's 6 implants kind of spread out evenly throughout the upper jaw. And then on the lower jaw, 4 implants in all the literature is considered gold standard, but we typically will do 4, 5, or 6. If you've got enough bone that I can spread out more than the 4, I'll routinely do that. And this is kind of what they look like on a artist kind of rendition here showing the lower jaw. This picture and video is showing when a patient's not, they don't have enough bone to place 6 traditional implants. Usually you're deficient in the back part of the upper jaw, and that's where we place these zygomatic implants. So they're still a regular implant. They're just a little bit longer. They reach out to a different bone, which is the lower part of your cheekbone for stability. But it's a way that we can bypass where patients do not have enough bone to put a traditional implant and avoid the typical sinus lift and bone graft that a lot of patients will need ultimately to be able to do this procedure, where we can do this one day and avoid that bone grafting procedure. And, just like this young lady here, she lives in the northeastern part of the United States. She flew over, no telling how many oral surgeons and other clinics that are doing this procedure to come to Lakeland and have this done because of the zygomatic implants. So if you look at the picture of her teeth that she had when she came to see me, that's a full bridge, but it's on just a few remaining natural teeth, and the bridge was failing. So she was very self-conscious about the possibility of losing this bridge and not having teeth in the upper jaw. So she came here to Lakeland. We were easily able to do this procedure. She actually had a lot more bone than what she was told at other clinics that she had. And she only needed 1 zygomatic implant on each side on the upper jaw. And this is what we were able to do for her. And that is her after picture. So all of these teeth, they're customized for every individual patient. It's not kind of like a one-size-fit-all or a small, medium, large. They are very custom to every patient. So everything is kind of hand-picked, handmade, and digitally made to custom fit your jaw on the implants that I put in that day.
You did.
Yeah, that's good.
What if one of the full mouth procedure implants fails? Can it be replaced? Would surgery be required again?
Well, that's a great question. And the answer to that is yes, they can be replaced, but I've never had to do that. So I've had a patient to lose an implant or have an implant fail, but I've never had a patient lose the entire bridge or have all the implants fail where the entire bridge failed. So that would be super uncommon. So these implants, implants across the board in the United States, all the books and the literature state that they're 85 to 90% successful. That's very, very high for a surgical procedure. When we do this new teeth nail procedure, I think it's even higher than that, because when an implant fails, usually it's because the implant was placed next to a natural tooth that already has some problems. Yeah. So if that tooth has some periodontal disease, some inflammation or infection around it, then sometimes that can jump over to the implant and cause a problem with the implant. With our new tooth nail procedure, we're eliminating that as a possibility of an implant failure because we're removing all the remaining teeth and making sure there's a clean slate. So when we put these implants in, they're in very healthy bone, and we kind of give you some guidelines to follow throughout the first 5 to 6 months of the healing phase. And if you follow those, these things should be very successful. So we think our success rate is kind of mid-90s or higher.
That's awesome. Let's see, after receiving the fixed upper, are there any specific care requirements to care for it? Is it expensive to care for it on a daily basis?
So there's kind of two questions with that. They're very easy to take care of, kind of the same way that we do with our natural teeth. Toothbrush, toothpaste, you do that a couple times a day. You just make sure you're taking care of them, cleaning them at home. And then every 6 months, we do recommend that you either come here for a true cleaning, just like you would with your natural teeth, with a hygienist at a general dentist office. And what we do with that is we actually take the teeth out. There's no numbing medicine. You do not have to go to sleep for that. It's very quick, very easy. The teeth are just unscrewed. We can take those out. They're clean. They're disinfected. We make sure that the gums look healthy and your gums look really nice around those abutments, the little connectors that the bridge is screwed to. And then we put the teeth back in. So we kind of make them almost like new again. So we do the cleaning process, and then they're steam cleaned. So anything that would stain a natural tooth, smoking, tobacco products, tea, coffee, grape juice, red wine, anything that would stain a natural teeth can stain these bridges. But when we do the steam cleaning and the disinfectant, it takes them back to like a brand new state. And then we put those back in and you leave. So it's a very quick, easy process, kind of easier than what I go through when I go to Dr. Nafala's office, one of our restorative doctors, to get my teeth clean. I have to sit there and wait for the hygienist to scrape and clean. And then they do their little polishing. Like that's all done inside my mouth. The cleanings for these procedures, these new teeth nail bridges, they're done outside of the mouth. So it's very quick, very easy.
It's easier than a regular
Yeah, and for the, we see a lot of patients that fall into the category of the phobia of dentist, fear of dentist, the dental chickens. A lot of our patients fall into that category.
That's perfect. You're talking about that because we have someone who's talking about general anxiety and panic attacks. Like how do we help?
Perfect. So what's the question?
I have extreme general anxiety and panic attacks. Can your facility accommodate someone like?
Yeah, so our facility is set up for you. So we see a lot of patients come in, and the reason that you're in the category that you need this procedure done is a lot of times related to that. So if you have and we hear patients come in all the time, and they'll tell me in the consult that, hey, you don't really understand. When I was a kid, I had this awful experience at a dentist's office. They were working on a tooth or a couple teeth, and they numbed me up, but I could feel everything, and that led to kind of their fear of the dentist, where they just avoided the dentist for years and years after that. Mm-hmm. And that led to kind of a demise of their teeth. So now they need this procedure, but you're totally asleep for the procedure. And with the cleanings, when you come in for the routine cleanings, there is zero pain or discomfort with that because everything is done out of the mouth. So it's really set up for you, whoever asked that question.
Yes. One more for now, and we'll jump back to questions later because we're getting really good questions. Thank you, guys.
Perfect.
The difference between fixed dentures and full implants.
That's a great question because actually on patients, she's very popular on a lot of social media platforms. And I was reading through typically don't do this and spend a lot of time on social media, but because I was, we were a big part of her care, I was reading through some of the comments, and some people were asking and making comments that, well, she said she was getting implants. This is just a denture. It is by far, night and day from a denture. A denture is something that covers the roof of your mouth, has wings or those little flanges that go underneath the lips and underneath the cheeks. This is nowhere near that. So yes, it is, we're not doing one implant per tooth. It's typically 6 implants on the top, 4 to 6 implants on the lower, and they secure and hold this entire bridge. But it is a bridge. So if you've ever been missing one tooth, and then your general dentist will make a bridge from the tooth in back to the tooth in front, and there's that floating tooth in the middle, that's a bridge. We're doing the same thing on implants. So it is a screwed in bridge, covers very little of the inside of your mouth or the gum tissue. The roof of your mouth is completely open. And one of the things that patients said, when we put in her surgery day teeth, that, that same day we did the procedure, the lab made the teeth custom fit her implants and her jaws. So when we screwed those in, she immediately said, she's like, I have teeth in my mouth, and you could tell her tongue was touching the roof of her mouth. She goes, it's been so long that I could feel the roof of my mouth with teeth in my mouth. Because when she had her denture in, it was completely covering the roof of her mouth. So it affected taste, it affected her speech, and now it's totally wide open. So are they the same as your natural teeth? Absolutely not. No one has anything that's as good as your natural teeth, but this is as close as you can get to having that same feeling on a secure bridge that will allow you, once they heal, to treat them exactly like you would your natural teeth. You can eat anything you want, and you brush them. Toothbrush, toothpaste. You don't take them out like a denture or a partial and wash them, under a sink with soap and water. You toothbrush and toothpaste. So totally different from a denture. They are a fixed bridge that's screwed into implants. But I'm glad you asked that, because I was going to address that, or anyone asked that question or not. So keep those questions coming, and we will get to them.
We will break for questions in a few slides, but we have a lot of good info that we want to go through.
Yeah, absolutely.
Thank you.
So for patients who are very deficient in the upper jaw, we do have, like this patient here, the before and after. So this patient literally has no bone in the upper jaw. Super, super thin. I mean, it's almost paper thin. And without the zygomatic implants, a patient like this is stuck with either no teeth or a denture. And even with a denture, there's so little bone, the denture has nothing to kind of suction to or snap into. Even with the denture adhesives or the glues, this patient, without the zygomatic implants, they're kind of stuck with something that is truly just a very poor fitting denture. And it's there for more just a cosmetic look. They can't eat very well with denture in on something like this. They're using a lot of glue just to keep it in so they can be out in public, smile and look like they have teeth, but they can't really eat. They're stuck the rest of their life, soft foods, hoping that and trying to do the best they can, pushing the denture up with the tongue, trying to keep their fingers constantly pushing it up just to give some stability so they can eat very soft foods. But what we were able to do with the zygomatic implants and with somebody who really does not have a lot of bone, we can do these quad zygomatic implants. So we put 4 of the zygomas in. They anchor 2 on each side at the lower part of the cheekbones, and they are super strong, super supportive, and they just give a really stable platform to secure this bridge on. And once they're healed, then patients they can take a bite out of an apple or corn out of the cob and not have any trouble eating foods. So who's a candidate for this procedure? Yep. So if you have no teeth or you're unhappy with your dentures, that's kind of a no-brainer. You're definitely a candidate. If you have a mouthful of bad teeth that maybe you've been to a general dentist and they give you this, 2-year treatment plan, where they tell you like, hey, we can do this, we can fix everything. The number one question that I would tell you to ask that dentist is, if you sit and go through the procedure, you spend the time, the money to go through the procedure, how long is it going to last? Like, what's the prognosis? So a lot of times they can't give a really good prognosis, or they'll just say, hey, I'm really not sure. We can do this, we can fix what you got, but we don't know how long they're going to last. So patients who are in that category, this is a really good option, because it kind of takes you out of that hamster wheel of the constant, like every 6 months, every time you go in for a cleaning or a checkup, hey, there's decay under the crown, or you've got another cavity, or this tooth needs another root canal. We can eliminate that. If you have severe periodontal disease, definitely you should keep this option open as a good option to replace your teeth, because periodontal disease, if you're in the initial stages, it's something that can be treated and you can maybe keep your teeth. But once it gets to a certain level, there's really nothing that anyone can help you with. The best that they can do is kind of help you keep it from getting worse. But over years, it's almost, I don't want to say that it's pointless to go through the cleanings, but it's one of those things where we call it watchful neglect, because once your periodontal disease gets so bad, I can promise you, year after year, when they take those x-rays, your bone loss is a little bit worse, a little bit worse, a little bit worse. They're never curing. It's something you cannot cure. It keeps getting worse until you get to the point where you've got to make the decision that you're doing a denture or doing our new teeth nail procedure. So a lot of times we'll try to talk to patients, before it gets really bad to where you need like that quad zygomatic implant procedure, just let's go ahead and take the teeth out, do the implants, get your mouth into a really healthy environment, and then you don't have to worry about the infections anymore.
And that it removes the periodontal
From day one.
Yeah.
So when I had a patient today come in, severe periodontal disease, a lot of teeth that had a lot of decay, but when that patient left the office today, 0 infection in their mouth. So they came in this morning, 7:30, when we were putting them to sleep, a lot of infection in their mouth. When they left at like 2 o'clock, it was pretty straightforward. We kind of very efficiently went through the procedure. The lab was great today. They got the teeth back a little earlier than we expected. And that patient left with an upper and lower bridge screwed in on the implants with 0 infection. Kind of, just a fresh start. And then the other item that would make you a candidate, and this is one that I see it almost every day with patients that come in for the consult. They always tell me that, and I don't get this because of the zygomatic implants, but a lot of patients will come in and they're like, I've been to 3 or 4 other providers, and I'm here just because one of your commercials, your website told me that, or you said in a webinar, like I said earlier, I've never had a patient that I couldn't do this because of a bone loss problem. And they're like, I've been told by 3 or 4 other people that I'm not a candidate for implants because I don't have enough bone. And then I'm going through the CT scan, and they're very straightforward. I saw, which really kind of took me off guard a little bit, and it's very rare for me to kind of get taken back because of a comment of a patient, because we see everything. And so I'm going through the upper jaw. She even got to the lobe, and I'd measured, and I was like, hey, hey, you've got plenty of bone, very straightforward. You don't even need the zygomatic implants. We can do 6 traditional implants. And she kind of looked at me and she was like, I don't understand. I'm like, well, what are you talking about? And she was like, you're telling me that you can do this without the zygomatic implants, and that I've got plenty of bone to do this. And she was from Florida. She was on the east coast of Florida. And she was like, I just had a consult 2 weeks ago, and they told me that I didn't have enough bone to even put an implant in.
Yeah.
And I'm looking at her thinking, I probably wouldn't go back to that office because you can do this very straightforward with just traditional implants. So if you've been told that you don't have enough bone for implants, call the number, come in, it costs you nothing but your time to come in and see me for a consult, and we'll talk about it. We'll go through the scan. You actually see so I put the CT scan up on the screen, and as I'm treatment planning and showing you how much bone you've got, where you've got good bone, where I'm going to put your implants, you're seeing that live with me. And so it's one of those things, definitely, if you've been told that you do not have enough bone for implants, come in and see me, because I have not found a patient yet that did not have enough bone to do the procedure. So once again, and there will be a quiz at the end of this webinar on the 3 key differentiators. And I can't stress this enough. We talk about it a lot, but a lot of patients, they'll go other places. And then when I ask them, like, well, who's going to do your surgery? Was it a oral surgeon, board certified oral surgeon? They don't even know. They call them, because the people that advertise for this, they call themselves implant surgeons. There's no such thing. If you look at the Florida Board of Dentistry or any of the dental specialists that are truly recognized as being a dental specialist, there is no such thing as an implant specialist. You're either a general dentist, you're a periodontist, you're an endodontist, which is like a root canal doctor, or an oral surgeon, or pediatric dentist, which they're not going to be doing this procedure, or an orthodontist, putting on braces and straightening your teeth. So it's one of those things you really need to know, do your homework and research on who's going to be doing this procedure. Do not let a lot of the advertising, the false advertising, or as our current president would say, don't believe the fake news. There's no such thing as an implant specialist.
Right. It's most likely.
It's most likely whoever that they do implants, they're calling themselves, I'm an implant specialist. Well, there's a lot of people that can place implants, but you want to make sure who's doing this as a board certified oral surgeon. I cannot stress that enough. So when you come here, your first appointment will be a consult, and you'll meet one of our implant coordinators. And these 4 young ladies, Shauna, Chastity, Allie, Crystal, they are very special people they have been surgical assistants. So they've actually sat and watched and been a part of this procedure. So they truly know the ins and outs. And then they've been doing the coordinator positions for years. So they're very experienced. They've talked to a lot of people on the phone, a lot of people in the chair about this procedure. And by the time I walk in, when it's kind of my turn to come into the consult and really kind of go over the nuts and bolts about how we can do this, where we're going to place the implants, your medical history, I'll start going over a lot of, questions that you may have, or your CT scan. And it's super common, which I love, that they've already gone over most of it. And a patient, I'll start thinking it's kind of cool that I'm showing you where your nerve is or your sinuses. And they'll say, oh, Allie already showed me that. Or, Crystal showed me where the nerve is and the hole in my jaw where the nerve comes out. And it's so cool. And it goes to my lip, give me feeling, and then I'm going over that, like how I'm going to miss that surgically with the implants. And so that is reassuring to me that you're getting a lot of good information about this procedure. And that's what we're all about. When you come in, it's very transparent. We want to be open. We want to show you what you've got, tell you what we can do, and how we can get you to your goal and kind of accomplish that goal of getting an implant-supported bridge in.
Could we do 2 questions?
Yeah, perfect, Coach.
This is just about like the process. So how long does healing take on average? How long before you get your permanent, like your final teeth?
Sure, that's a great question. So there's a couple different things about that question about how long is the healing. So the surgical side, if you watch some of patients' videos or you go and follow her on her social media, she kind of goes through the initial couple of days that she's been through now to this point. But, you can typically expect from the surgical healing and recovery. You can expect 2 to 3 days of some swelling and bruising. Then the swelling starts to go down pretty quick. Once that swelling goes down, then you kind of get into the phase of your bone cells fusing and healing to the implants that we put in. That process takes about 5 months, and that's because of the upper jaw. The lower jaw heals about half the time. So 2 to 3 months, implants are totally fused with the lower jaw. The upper jaw is a little softer, spongier bone. That's why we put more implants in on the upper, but it also takes a little bit longer to heal. So that 5.5 months is how it takes for your upper jaw bone cells to grow and fuse to those implants. Once that process happens, then we put you into your quote final teeth. We here at New Teeth Now, we do it a little different than most other places. We actually put you in the final material a couple weeks after your surgery, which is a really, really big bonus for you as the patient. We started doing that kind of selfishly because with these surgical same day teeth that we put in, it's a 3D printed set of teeth, which the technology behind that blows my mind every day because it just amazes me on how they can do that. 3D print these teeth and they fit your implants in the position I put them in perfectly.
It's really awesome.
And I mean, it's amazing, but they're a 3D printed material. It's a very strong material, and the company that makes that material says that they are strong enough to last you 5 to 6 months while your implants are fusing. They do. We do not argue with that, but we have a lot of patients, like we said, come in from out of state, out of the country, and occasionally we would hear, 1 out of 100 patients may call us, and it's always on a Friday night, which I never get that, but it's always on a Friday night, weekend. They'll call our answering service, which we're available pretty much all the time for any problems or concerns that you have during the recovery. And they would say like, hey, I woke up and my front tooth broke off. And then I'm on FaceTime trying to guide them through the process of super gluing the tooth back in place, because some patients just can't come back into Lakeland, really quick next day or Monday. So we'd have them super glue the tooth back in place, and then whenever it's convenient or whenever they could, they would come back to Lakeland and we'd swap the teeth out, print them another set. We kind of got over that. We kind of fed up with, if it happened 1 out of 100, that was too much for us. So we started making, for out-of-state patients, we would make that final material, the zirconia, for out-of-state patients to go home with. And it worked so well, and those patients loved it. The feel, the strength, they look better, the gums, and what we found out doing this, the gums heal better to this. So we are starting where we put everyone in temporary zirconias. So the final teeth, you get a couple weeks after your surgery. Now, it's still not your final set though. So we let you wear those while your body and your bone are healing to the implants, but we know you're not ultimately going to be really happy with those. And I'll kind of talk about the other clinics that are doing this.
Yes.
But we still wait the 5 to 6 months to let your bone totally fuse with the implants and your gums go through the process of healing and shrinking. We know that's going to happen. So if this hand is your upper jaw and your upper gums, the day we put those teeth in, it's intimate relationship touching. As you heal and your gums get very happy and healthy, they shrink. They shrink and they tighten up around our little connectors, the abutments. But as they shrink and heal, you get this little gap that forms in between your bridge and your gums. Could you live with that? Sure. Do we want you to live with that? Will you be really happy with that 5 years from now? No, because we know we can get you a better fit, a more custom fit to how your gums heal and shrink and tighten up around these abutments. So we still make you a second set of zirconia teeth once you've gone through that process. So it'd be very quick and easy for us to say, hey, that's your final set. Guess what? We can put you in final teeth in a week, 2 weeks. And that would be the easiest thing for us to do. Hey, congratulations, you're done. You're in your final teeth. But we know you're not going to be really happy with that. So we let your body go through that process of healing. Then we make you that final set of zirconia teeth that, see this? Look, it goes up and touches that gum tissue again. Very, very important for you to understand. Because, and even me, doing what I do, so I know the ins and outs of this because I'm very experienced and done this for now 18 years. That's crazy, by the way. But I've been doing this here in Lakeland for 18 years, since 2007. And, I get targeted with those same ads that you probably get targeted with. And, the Nuvia, the Clear Choice, all the other wannabes that try to do this procedure, they talk about, and you'll hear it on their social media or their advertisements or TV. Hey, there's some places that make you wait 6 months before you get into your final teeth. We can put your final teeth on the next day, or 24 hours or 48 hours or a week. Well, that sounds great. And if I didn't know what I was talking about, that sounds really cool to me too. But I do know what I'm talking about, and I know you're not going to be happy with that. So, I always kind of laugh at those ads because I can do that too. There's nothing special about that. We can put your final teeth on 24 hours later too. And that would be way easier for me and my office to put those in and just tell you, hey, good luck, you're in your finals. Call us if you need us. But you're not going to be happy with that. And if you're on here and you've had one jaw done and you need the other done, and it was done at another clinic where they did that, you know exactly what I'm talking about because we hear it and see it all the time when patients come in and they're like, hey, I need my lowers done. I did my upper with another office and now I've got this gap and, air escapes. It affects my speech. Food gets stuck there and they want us to remake it. And we do. But guess what? You've already paid for that and now you got to pay for a new bridge because it wasn't done the best way.
The first deal. Oh.
So it's a lot easier to just do it the right way the first time and be done.
Mm-hmm.
Kind of go throughout your life and you don't have to think about your teeth anymore, except every 6 months, you do have to come and see us for a cleaning. So our restorative team, great questions, by the way, keep those coming. So we're going to go through a couple other slides and then we'll take more questions.
Sounds good.
So our restorative team, actually, I just left Dr. Nafala. He almost killed me with us telling Bianca. He had some hot peanuts, almond nuts. I got choked with one of those driving over to Lebanon. So I'm going to give him a hard time about that tomorrow. But Dr. Nafala, Dr. Dibbs, Dr. Perez, we are very fortunate to have those 3 restorative guys as part of our team. And that team approach is very important. Everyone here, from the people on the phone to the coordinators to the people at the front that will greet you when you get here, to the restorative docs, to our lab, to our assistants, everyone here, this is what we do on a day-to-day basis. And Dr. Dibbs going to give a little video? Perfect.
In a video.
Okay. So I'm going to let Dr. Dibbs talk about what it means from the restorative side of things, having everything under one roof and us and the entire team here in one office.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Perfect. So, another important fact that Dr. Dibbs kind of touched on it, but not enough. Having surgeons, the restorative, the lab, the coordinators, your follow-ups, your pre-op impressions, you're coming here to one location. So a lot of other places, they'll be doing the initial consult, taking your impressions, making your teeth, but then they'll say, hey, you gotta go over to this office, to the surgeon, do the implants. Then you'll go to the lab down the street and they'll pick out the color of your teeth, or you'll go there to pick out your color. And here you're doing everything here in one office. And for the patient, that is a really, really convenient and really good way to do this, because like if Dr. Dibbs or Nafala or Perez, if they have a question, today was a great example. Dr. Perez came down, I was working on a note, filling in a chart note, and he came down, he's like, hey, can I ask you a question? A patient was asking me or talking about this. And, here, if we weren't all in the same building, then he's got to call me. I've got to get back with him. And, it's one of those things where now it's just almost in real time. If you have a question on the restorative side, he can come ask me, or I can run upstairs, see you with Dr. Perez or Dr. Nafal or Dibbs. And it's, it's one of those things that just makes it really convenient and more efficient for you to get the best, the best product at the end of the day, which is your goal.
Definitely.
Yeah. So me and my surgical team, and I think a few of them may be on here actually watching tonight, but Ashley, Monica, Amanda, these three girls, they've been with me for a long time and very good at what they do. And you'll get to know them. Like if you come in to do this procedure here with me, you will know them on a first name basis. And I don't tell them enough. I do every now and then, but they always give me a hard time. But they are really good, and I'm lucky to have them, because a lot of times patients will come in, during that recovery phase, and they'll have a lot of questions. Like, hey, is this normal? I'm having this, or I'm experiencing this every now and then. And by the time I come into the room, after they've brought you back from the waiting room, put you in a room, talk to you about why you're here, what's going on, they've almost answered all your questions. So they'll come in and they'll say, hey, like Mr. Jones is here. He's 2 weeks out from his surgery, or he's, 6 months out from surgery. He's here for a final check. He was asking about this. I told them that's fairly normal. And then I go in and the questions are answered. Mm-hmm. And that's, I love that, because if they weren't really experienced, then, when I come in, I would have to address all of that, which I'm fine doing. But it's really nice from me, the patient, and our entire team that, they kind of, everyone's on the same page. We've all done this. This is what we do on a daily basis. And it just makes it very efficient and nice for the patients going through this process. So our new teeth now process. So your first appointment and first step is you got to make that phone call, come in, schedule the consult, come in for the consult. During that procedure, that's when you spend some time with one of our implant coordinators. They kind of walk you through the entire process, from the pre-op impressions to the surgery to all of the post-op care. And then the next appointment would be for the pre-op and impressions. So the pre-op, you come in, they go over the procedure again, you get your impressions, and that's when you meet one of our restorative doctors. And that's also when I think it's a cool part of the procedure where you pick out what you want your teeth to look like. So the size, the shape, the color, and talk about like what if any pictures that you have of teeth that you think are a nice smile, or maybe when you were younger and you have your teeth, if you have a picture of that, and hey, I would really like them to look similar to this. That's when you would discuss that. And the restorative team, they help you pick out what you want your teeth to look like. Then they design your case and they print those and they give them to me to use for your surgery. And then your next step is the new teeth now surgery. That's when you come in, and that's kind of your date with me, where we do the procedure. If you have teeth, we take those out. If you don't have teeth, we're just putting in the implants, and we put the teeth on at the end of the day. You're kind of my patient for the first 5 months, because I want to walk you through the first 5 or 6 months to make sure that everything heals really well to get you ready to start your final teeth, to get that custom best fit to your gums that we were talking about earlier. And then it's the post-op and any adjustments that you may need. So just like, if you go into a general dentist, you have a crown or a filling placed, when they put that crown on, they have you bite on the paper, kind of tap, 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 and then they, any high spots, they adjust and polish those down. We do the same thing with these, and then place the final teeth 5 to 6 months later, and then it's just routine care and maintenance. Those are the regular cleaning appointments every 6 months, and we're just checking, we're making sure that everything looks good, everything's healthy, that you're doing a really good job keeping these things clean at home. And if we see any problem areas like, hey, gum's a little red here, make sure you're, hitting that a little bit better with your toothbrush or the water pick. And we just kind of walk you through that process every 6 months. So these things, you can enjoy these for decades and decades to come.
Michelle's slide kind of closes out our webinar. So maybe we do some rapid fire, answer all the questions, and then we can do Michelle, and then I'll talk about pricing and financing and all of that. So thank you guys for sticking with us. We have had so many good questions. It's been awesome.
Perfect.
Will the implant slow down or stop bone loss?
Yes, absolutely. So what happens with your upper or lower jaw, if you have infection around the teeth, your body's not happy. So it starts kind of trying to fight the infection, but there's also that inflammatory reaction, which causes your gums to swell, maybe bleed when you brush or floss, and then your bone starts to pull away from that. Because your body's very smart, so it tries to recover and take care of things as they happen. So if you've got infections around teeth, or you start in that process of periodontal disease, your bone shrinks away. It's trying to pull away from the bacteria, so it pushes your teeth out, almost like getting rid of a splinter. And as that happens, you get more and more bone loss. When that tooth comes out, then the root is out of the bone. The body's very smart about getting rid of things that it doesn't need. So if you do not have those teeth roots there, then your bone shrinks up a little bit. So we'll see a patient that had a denture for 5, 10, 15, 20 years. The bone really shrinks up. And that's when you may need the zygomatic implants. But when you put in that implant and it becomes a healthy, stable implant, your body almost gets faked out into thinking it's a healthy tooth root. So it gives it a reason to hang on to that bone. And so whatever bone loss you've had, it never regrows. We can't replace that. But the implant's a healthy implant, can keep that bone loss from getting worse.
That's awesome. if I have very high cheekbones, would zygomatic implants still work?
Yeah, that's actually even better for me. So if you have a lot of bone loss and you need the zygomatic implants, the better cheekbones you have, the better for me when placing these zygomatic implants. But yeah, that's definitely not a bad thing. That's actually a good thing if you have high cheekbones, or very prominent, pretty cheekbones.
All right, we have 3 more. How long is the procedure?
So the
Surgery.
surgery itself, it usually takes about 3 hours, sometimes a little quicker, sometimes a little longer, depending on how many teeth or how hard. Typically, the thing that would slow me down the most in surgery are the teeth. So all the extractions. So if a patient has a mouthful of bad teeth, they almost have every tooth in their mouth, and they all have decay. That's what would take me the longest, is just removing those teeth. And I try to do that as gentle as possible. So that takes a little bit of time and I like to be the one to remove the teeth if I'm going to be the one placing the implants, because I know that I'm going to be as gentle as possible to the bone. So because the easier the teeth come out, the easier I can get those teeth out, then the better bone left for me to put the implants in.
Awesome. Lisa said, I actually started an implant. I have the screw in my jaw. Would you be able to work with that, or would I have to start all over?
Sometimes. So that, I try to use, and I would love to use every implant that you already have had placed in the past. When we can hook those up, that's already a happy, healthy, stable implant that can be braced with this bridge to all the new implants, and it gives them a more solid foundation so they heal better. But in reality, most implants, even ones that I put in for a natural tooth or kind of a single tooth replacement, those typically have to come out because the depth of these implants for this full arch bridge is a little different, the angle and the depth, than what a natural tooth would be. And, for one front tooth, I had a patient that had tooth broken from a softball injury, and they'd had a single implant placed. It looked great, super healthy implant, but they started to have problems with the rest of the teeth. They needed this procedure done. And that one implant was angled perfect for a single tooth replacement. But for this bridge, if we left that implant in, the screw hole would be coming through the front of the front tooth. And there would be a screw channel there. So a cosmetic disaster. So we just remove that implant just like a tooth. And that's typically what we would do with an existing implant, because we want these implants positioned perfect for your bridge, not for the single tooth implant that you had years ago.
Perfect. Then what about bone density? My mom had it done, but her bones were too soft. So now she's back to denture.
So if the patient had implants placed in the past and for some reason the implants failed, could it be from bone density? Maybe. That's still very rare. Typically there was something else going on from an occlusion standpoint, the way the teeth meet, maybe infection around the bone, maybe they were loaded too early, or maybe that just something simple like that, the diet that we put you on. So we put you on a softer diet while your bone is fusing to these implants. It's hard to say what would actually cause an implant to fail, but it would be very rare for it to fail because of just a true bone density standpoint. But definitely if they had some implant failures, then I'll be looking into possible reasons why, as I'm looking at your CT scan specifically, and that's when we may turn to the zygomatic implants.
Gotcha. Really, really good questions. And basically, we're going to watch this last video. I'm going to go into ballpark pricing, financing, insurance, all those details for everyone who is waiting on that. But thanks, guys.
Yeah,
cool.
Great. So we're going to let Michelle give her a little testimony and kind of what she went.
Thanks to New Teeth, now I can smile and I can live a healthy life. Today I got my final teeth in, and I am so excited. I can't wait. I would never eat with my front teeth. Everything was either broken into pieces and put to the side. I would never bite into anything because whenever I did, they would wiggle and feel loose, so I was afraid to do that. I had loose teeth, periodontal disease, and I knew that I couldn't do dentures. I knew that I wouldn't be comfortable in them, I would never be happy. I had been to other dentists, and they had told me within 5 years you're gonna lose all your teeth, and you have no bone to support your teeth. I researched, and New Teeth Now came up on my computer, and I was reading about the zygomatic implant. All I heard was it's good for no bone. I said, I think this is the place we need to go. When I met with Dr. Kirkpatrick at my consultation, made me feel very comfortable in this decision that I was making to change my life. I went in, I woke up a few hours later. Relatively easy, I guess you could say, because I don't remember it. But believe it or not, I did not have any pain, none. I myself was shocked, and I was the one going through it. I think I held the mirror at New Teeth Now for like 20 minutes, and when they took it away, I said, no, give it back. New Teeth Now changed my life in one day. My doctor believed that getting rid of my teeth and my periodontal disease had a major, major factor in my health being what it is now. She's like, if I could call New Teeth Now, I would personally. If you have periodontal disease, loose teeth, bad oral health, just make a phone call and go to the consultation. And it will definitely change your life, but you have to make the first phone call. It's life-changing, it's amazing. I couldn't be happier right now.
She looks great.
Yes, she does.
I mean, look at that after picture.
I know. She's so beautiful.
And the cool thing before you get into the resources and the pricing, one of the really cool things about this is everything is custom. So like what her final teeth look like is what she wanted. Mm-hmm. Some people want a more natural appearance. I've got my own opinion, and I got patients all the time on like Hollywood white. I'm glad she did. I think she looks great.
Yeah, it's good.
Yeah, so I'll hand it over to you.
All right, so we'll talk about resources. And I've mentioned this a little bit before, but feel free to follow us on our social media platforms. You can see lots of before and afters, and you can message us at any time, and I actually read those, so I can just respond to you and talk to you about whatever questions you have. And then on the New Teeth Now community, that's a great place to join on Facebook. So if you type that in like the Facebook search bar, we have almost 700 people on there now. So lots of current, past, present patients. Everybody's on there. They give great advice of their personal experience. So that's a really good place just to connect with others that are going through similar things that you might be going through right now. I appreciate you guys coming on here tonight and asking really good questions. Thank you for taking the time to be with us.
For being here.
Okay. And I just encourage you to reach out, and we would love to talk with you.
Absolutely. Thank you, guys.
Have a good night.